Blood pressure. Blood pressure is the pressure of blood in your arteries, the vessels that carry your blood from your heart to your brain and the rest of your body. You need a certain amount of pressure to get the blood moving around your body. Your blood pressure naturally goes up and down throughout the day and night, and it's normal for it to go up while you're moving about. It's when your overall blood pressure is consistently high, even when you are resting, that you need to do something about it. Blood pressure is a measure of the force that your heart uses to pump blood around your body. Blood pressure is measured in millimeters of mercury and is given as two figures. Systolic pressure, which is the pressure when your heart pushes blood out, and diastolic pressure, the pressure when your heart rests between beats. For example, if your blood pressure is 140/90 or 140/90 millimeters of mercury, it means that your systolic pressure of 140 and a diastolic pressure of 90 millimeters of mercury. As a general guide, ideal blood pressure is considered to be between 90/60 millimeters of mercury and 120/80 millimeters of mercury. High blood pressure is considered to be 140/90 or higher. Low blood pressure is considered to be 90/60 or lower. Blood pressure is recorded using a sphygmomanometer. Blood pressure is the force of blood against the walls of the arteries. Blood pressure is recorded as two numbers. Systolic pressure is the number on top, and the diastolic pressure is the second number on the bottom. When measuring a patient's blood pressure, you should always be aware of factors that can affect the reading and possibly give a false reading, which could include to unnecessary medical investigations. These include a blood pressure cuff being too small or placed over clothing, the patient having recently exercised, if it is cold or otherwise uncomfortable, if they consumed alcohol or caffeine less than 30 minutes before taking a blood pressure, if the subject is anxious or stressed, or if the subject is talking during the procedure. Blood pressure may vary according to whether the patient is lying down, sitting, or standing, and is normally recorded with the patient sitting. In order to take a blood pressure, you will need a sphygmomanometer, blood pressure cuffs. They come in various sizes: small, medium, large, extra large. A stethoscope. So ask the subject to sit down. The subject should have rested for 3 to 5 minutes before starting. You should wash and dry your hands. Explain to the subject what you are going to do, as this will help reduce their anxiety. Explain the sensation of the cuff tightening on their arm and reassure them that it is safe. Ask the subject to loosen any tight clothing or remove long-sleeve garments so that it is possible to access the upper arm. Do not use an arm that may have a medical problem. Place the cuff around the upper arm and secure. Connect the cuff tubing to the sphygmometer tubing and secure. Rest the patient's arm on a surface that is level with their arm. Place the stethoscope over the brachial artery, which is in the bend of the elbow, and listen to the pulse. Pump up the cuff slowly and listen for when the pulse disappears. This is an indication to stop inflating the cuff. Start to deflate the cuff very slowly while watching the mercury level in the sphygmomanometer. Note the meter's reading when the pulse reappears. Record this as the systolic pressure. Deflate the cuff further until the pulse disappears. Record this reading as the diastolic pressure. Record these two measurements, first the systolic and then the diastolic, in the patient's notes or chart. Tell the subject the blood pressure reading. Then disinfect the stethoscope with alcohol and wipes. An extremely low or extremely high reading should be reported to a clinically qualified individual. High blood pressure is often related to unhealthy lifestyle habits, such as smoking, drinking too much alcohol, being overweight, and not exercising enough. Left untreated, high blood pressure can increase your risk of developing a number of serious long-term health conditions, such as coronary heart disease and kidney disease. Low blood pressure is less common. Some medications can cause low blood pressure as a side effect. It can also be caused by a number of underlying conditions, including heart failure and dehydration. The latest automated digital devices make it quick and easy to check your blood pressure, or your healthcare provider might take a manual reading using a stethoscope held against your arm to listen to the blood flow. Try to relax. It may be a little uncomfortable, but that's only for a few moments. Your healthcare provider will probably check your blood pressure reading several times during an appointment. If your blood pressure is high, they may recommend you have more readings over a longer period to make a definite diagnosis. There are varying ways to do this. One is you can wear a device on your arm for 24 hours as you carry on normal activities. This is called ambulatory blood pressure monitoring. The subject can also measure their own blood pressure every morning and evening for 4 to 7 days. This is known as home blood pressure monitoring. You should measure your blood pressure after sitting in a quiet room for 5 minutes. High blood pressure rarely has noticeable symptoms. That's why it's so important to get your blood pressure checked. It is usually checked with using a digital electronic monitor, which is connected to an inflatable cuff that is wrapped around your upper arm. When you have your blood pressure measured, the reading is written as 2 numbers, systolic and diastolic. Every time your heart beats, it pumps blood under pressure to keep the rest of your body blood pumping through the arteries. You need some pressure to keep your blood moving, but if it's consistently too high, it puts extra strain on your heart and blood vessels. Other parts of your body, such as your brain and your kidneys, may be affected by high blood pressure. Sometimes high blood pressure is caused by another health problem you already have, but most of the time there's no obvious cause. Blood pressure is measured at 2 points. The highest level, when your heart muscle contracts and pumps blood out through the arteries. This is called systolic blood pressure. The lowest level, when your heart relaxes between beats and fills with blood. This is called diastolic pressure. The overall blood pressure reading combines these and is shown as 2 numbers measured in millimeters of mercury. A reading of around 120/80 is seen as healthy, and above 140/90 is considered high. Undiagnosed high blood pressure is very common, and the only way to know whether you have high blood pressure is to have it measured. So it is important to get your blood pressure checked.